is Dr. Nicholas Belize, and I'm a clinical psychologist that works for the Department of Mental Health through Los Angeles County. On April 16, 2007, a lone gunman shot and killed 32 students and staff and wounded 17 others in the worst school shooting in American history. Since that school shooting, the way that we manage problem individuals and do threat assessments has changed completely.
Dr. Maria Luz Martinez, a supervisor for the School Threat Assessment Response Team, START, with Los Angeles County Department of Mental Health Emergency Outreach and Triage Division. The START was developed in 2009 as a response to the Virginia Tech shooting in 2007. In that incident, the perpetrator, Sang-Wei Cho, presented with many warning signs that were missed. He was arrested by campus police, released, and he went back to school. No one followed.
The findings of the Virginia Tech Review Panel determined that although various individuals and departments within the university knew about several concerning behaviors of the perpetrator, no one person knew all of the information and nobody connected all the dots. The Office of Judicial Affairs, the dean, the school police, and the counseling center explained that they could not communicate with each other because of privacy laws, and the laws actually state that if there is concerning behavior and there are threats of violence or harm to self, you can share information in those situations, and they should have shared information which could have prevented the event from happening.
Also, he was placed in a psychiatric hospital. He was discharged with no plan for mental health treatment. Also, his peers and instructors were concerned about his writings. They did come together, but at the time, no one put together a comprehensive safety plan and a plan for intervention.
Since Virginia Tech, we now know that information critical to public safety should be shared between schools when a student moves from one school to another. Schools should promote the sharing of information internally and also reach out to parents or law enforcement agencies or mental health agencies when there are concerns for threats to self or others. Gun violence can be preventable and has been prevented in the past if you educate yourself, understand the warning signs, ask for help when needed, and when we follow all of those steps, we can stop the pathway towards violence. Also, repeated incidents of dangerous behavior or threatening statements should be reported to a threat assessment group who can properly manage the case. The Los Angeles County School Threat Assessment Response Team, or START team, is a threat assessment unit that seeks to share information and connect proper entities that can prevent harm to institutions while also helping the student of concern.
START is a collaboration with law enforcement, academic institution, and Department of Mental Health. START is the link between family members, the mental health providers, the school, and law enforcement if necessary. The goal of START is to provide intervention for students who present concerning behavior. It is not a punishment, but rather an opportunity to intervene. The START program was expanded in 2018 as a result of the Parkland shooting in Florida. Now, the START team is embedded in every service area throughout Los Angeles County. This was to enhance the services and provide prompt response to critical incidents. Our current partnerships include local and federal police. These partnerships include exchanging information to better understand our cases and develop effective intervention strategies. The START criteria includes students in K through 12 and higher education, anyone who's posing a threat to academic institutions. This could be a student, an employee, or anyone who has access to an academic institution. So there's a nexus between familial homicide and targeted school violence. Chronic bullying. The Secret Service has conducted several case analysis of actual school shootings. And among the findings, the common factor among those who carried an attack was bullying. Either the perpetrators were bullies or they were victims of bullying. Individuals who are actively doing research for the acquisition of weapons or explosives. If the individual presents with depression or suicidality, and they're actively seeking the acquisition of weapons, that poses a concern. And so those referrals must be submitted to START for further assessment. Individuals who present interest in the research of radical groups and ideology. A risk analysis of these individuals show similar characteristics with those who are planning targeted violence. These include depression, suicidal ideation, isolation, disfranchisement, unemployment, and lack of long-term relationships. The goal of START is to identify students of concern early on, prompting early intervention. Interventions vary depending on each case. Sometimes the student may require psychiatric hospitalization, sometimes residential treatment program, and in other instances, incarceration. Despite the intervention, STAR will continue to work with the student throughout the process. Training and consultation. Training for schools. This can include teachers, students, parents, and community at large. After conducting a thorough threat assessment, the STAR team will then go back and provide consultation to the schools or the referring party. Risk management and monitoring. START works with students long term. These cases are very dynamic. A student may present stability one day, but may then be triggered by a stressor and return to concerning previous behavior. Response time. START is a crisis team and responds in real time. We understand that situations require immediate intervention, particularly for high-risk referrals. This is our STAR model: to assess immediate danger, clinical assessment and collateral interviews, fact-finding and objective data gathering, develop and reinforce the safety net. START intervention goals is to stop forward motion. We want to be able to stop an individual from moving forward with their plans to carry out an attack. We want to be able to surface specifics of the threat. We also want to surface dynamics behind the threat, mitigate or eliminate the threat, and establish a comprehensive safety net. Data sources. These are some of the data sources we consider when conducting a threat assessment. Each case is different and may require different sources. Face-to-face interviews are crucial. We want to be able to connect with the student and understand their problem. Collateral interviews, home visit, and bedroom observation. We want to be able to empower parents to understand their children's challenges. STAR will visit the school and work with the school in terms of looking at the student's locker, their backpack, their desk, and their vehicle, and if the student is engaging in any weapon research or if there are any weapons registered in the student's household. Most importantly, social media, where we look at the student's communications and patterns online.
Some important things to consider when it comes to assessing for the potential for mass violence. First of all, there is no profile for a mass shooter or an individual who engages in an act of mass violence. More often than not, they're going to be a male, but there have been females that have also committed violent acts. When it comes to instances of targeted violence, people do not just snap. Targeted violence takes extensive planning, and often it takes weeks, if not months and years of organizing, planning, collecting weapons, and collecting the tools needed to carry out the attack. There are many different reasons people become violent, and no case is the same. Contrary to popular belief, suicidality is actually more of a common theme with people who go on to commit mass violence than having regular angry outbursts or homicidal ideations. Something else that's important to consider is that the media can often sensationalize and misinterpret a lot of the facts that are presented in some of these cases. For example, in the Aurora, Colorado movie theater shooting in 2012, they painted the picture of a perpetrator who was obsessed with the Joker, and that was the reason he shot up the Batman movie. This was actually not found to be true. There were a lot of warning signs and behaviors present in James Holmes' life that could have been prevented had somebody intervened earlier. Another important thing to consider when we're assessing individuals for the potential for future violence is that anniversaries are very important to them. These can be personal anniversaries or public anniversaries. For instance, some active shooters plan on carrying out their attack in the month of April because it's the same date that Columbine happened over 20 years ago. Another example of how anniversaries can be important, though, is when it's personal to the perpetrator. Sometimes perpetrators can carry out the attack on their own birthday. Sometimes they carry out the attack on the anniversary of the loss of a loved one, or sometimes they may carry out the attack on the anniversary of an event that was meaningful to them and personal to them. Maybe it's an event that was good for them or an event that brings back bad or sad memories for them. It's important to remember that when we are looking at problem individuals, factual data is critical. Often people try to find the next mass shooter, or they might have a bad feeling about somebody. Our program is not in the business of trying to criminalize or seek out students to get them in trouble. We work with actual data. We need to understand what is someone saying and what are they doing right now that actually makes them a risk for future violence. And data includes things like statements, behaviors, maybe sometimes hit lists, or maybe even things like collecting ammunition and weapons. It's important to understand that the level of risk within an individual case can and does vary. Many times, with someone who might be escalating on a pathway towards violence, they may seem or appear calm, and something else happens in their life, at school or at home or with their friends, that can escalate them to a point of being closer to breaching that pathway towards violence. Because of that, our threat assessment process often involves continuous checks on the individual and following them for months, if not years of their lifetime, to ensure that they have positive influences in their life and safeguards against them escalating on a pathway again towards violence. It's important for parents to understand that the bedroom is the most common place where weapons are found and also planning materials are found. Often, students that are planning a mass attack or are demonstrating concerning behaviors or statements tend to keep a lot of their information private, and that's why it's important for us to observe the bedroom as often as possible and for parents to really know what's going on in their children's bedroom and in their personal life. This can often prevent an attack before it happens because there are certain warning signs and clues in the bedroom that are not seen on the school campus. As you can see in this photograph of a past perpetrator's bedroom, it can be something as extreme as bomb making or explosive materials. As you can see in this bedroom of a past perpetrator, it can be something more subtle. Things like trash bags covering the windows, trash bags covering the television, trash bags covering the computer or the microwave can be signs that someone might be struggling emotionally or even with a mental health disorder. And as we saw in Columbine, a lot of the warning signs and materials of concern were actually found in a private journal that was kept by one of the perpetrators. In determining when to call for a threat assessment of an individual or to call for emergency services, it's important to understand the warning signs of an individual who may be on the pathway towards violence. One of the most important warning signs that is present in most, if not all, past mass shooting cases is a grievance with an individual or an institution. In most, if not all, past mass shooting incidents, the perpetrator has had a problem with an individual, an institution, or a group of individuals. The shooting, or the ultimate event, is their attempt to take out revenge on these individuals. Another common warning sign is a hit list. A hit list is a list of people or persons or maybe even places that the individual seeks to eliminate in their attack. It's important to understand that when you discover a hit list, this needs to be reported to law enforcement immediately because the people on that list need to be warned. Deviation from baseline or the normal behavior of the individual is also a crucial warning sign when it comes to the pathway toward violence. Most individuals who are escalate in a linear fashion where their behaviors and statements become more intense until they carry out the ultimate attack. If you work with a student who is always saying things that are offensive or dangerous, that may be their normal level of functioning, and it doesn't mean we have to call the police or arrest or hospitalize them every time they say something that's offensive. Conversely, if you work with a student who gets straight A's, who is doing pretty well, or has never said anything violent or dangerous before, and they're now starting to make concerning statements, that can be someone who is deviating from their baseline or their normal behavior. And this is a much more concerning phenomenon. One of the most common warning signs also when it comes to the pathway towards violence is people will leak the information. In the process of leakage, people will either text or post something or talk to an individual either within their friend group or their families or maybe even an acquaintance, where they're sharing their intentions of what they want to do. There are several reasons for this. Usually the individual will leak the information because they might be ambivalent about actually carrying out the attack. More commonly, they will leak the information because they want people to understand why they are doing this. If they end up dying in the attack, they want people to remember why they were suffering and why they carried out the attack. Another concerning warning sign is approach or stalking behavior. Many individuals who are thinking about carrying out a violent attack will start to stalk people or maybe even locations because they want to understand the normal behaviors that those people engage in because they want to take advantage of them on the day of the attack. Rehearsal behavior is also very common in the weeks leading up to a mass shooting or a mass attack. Many individuals want to know what it's going to be like on the day of the attack, so they will often go to look at the exits, look at the security presence, or even bring weapons with them to see if anybody notices them. Suicidal and homicidal ideations should always be taken seriously. Even though many people struggle with this, very few go on to actually follow through with their plans and hurt somebody. Once somebody makes a suicidal or homicidal statement, a threat assessment or crisis management unit should be called in to further evaluate the individual to see what intervention might be best. This does not mean the individual is always arrested. Sometimes it's about getting them mental health treatment or moral support in home or at the school. Another common warning sign is the dehumanization of others. Many individuals start to see their target as less than human. This can often be found in their journaling or their writing or their short stories that they do in their English class. Some individuals will start to talk about their targets as less than human, as savage, or as animals. This can be a good clue to the assessor or to the institution that this individual is psychologically separating themselves from the target so that they can kill the target with much more ease. Something else to look out for and take seriously is when people start to militarize their dress or dress in intimidating or provocative ways. Many teenagers like to identify themselves by dyeing their hair, painting their nails, wearing provocative t-shirts, but there is a difference between this and somebody who is trying to scare others. Often people who engage in mass violence or want to engage in mass shootings will start to pose with weapons in their pictures, will start to post social media posts of them with guns or knives, or might start to dress as if they're going to war. This is a serious warning sign and should be taken seriously. Individuals who undergo persistent actual or perceived bullying throughout their lives without resolution are at risk of becoming angry and taking matters into their own hands. This doesn't just happen in school, it can happen at work, it can happen at home, and it can also happen on social media. Another common warning sign with past perpetrators was that a lot of them had conflicts with peers and at home. Not just conflicts with their family members, but maybe their family members were inflicting conflict upon them. Many past mass perpetrators of mass shootings have undergone extensive trauma and also have a history of caregiver inconsistency in their lives. This can include, but is not limited to, emotional abuse, sexual abuse, physical abuse, or drug or alcohol abuse in the home. Also, many of these individuals have been through the system of foster care and do not have a positive influence in their life when it comes to parenting. When it comes to mental health issues, only about 3% of people who are mentally ill go on to become violent. Not all mass shooters have a mental health diagnosis, and mental health issues do not cause people to become violent or go on mass shooting sprees. It can be a factor, though, when it comes to people that are on a pathway towards violence. For example, if we're dealing with someone who's angry and wants to go on to hurt other people, the fact that they struggle with depression and are suicidal can make them get to the point where they have nothing to lose. Their mental illness, combined with other life stressors, can combine to have a violent outcome. Perpetrators may also fake mental health symptoms. This happens often after they're caught, because a lot of times these individuals want to get off on the insanity defense and not serve time in jail. They would rather go to a psychiatric institution. A lot of past shooters have said things like the voices made them do it, or that they might have been in a psychotic state at the time of the shooting, which often isn't true. Many people who are suffering from psychosis or who are hearing voices do not have the organization or planning skills at that time to really plan and execute a mass attack. Sexual stress or frustration is a theme that is becoming more common with people who want to become violent, particularly among young men ages 16 to 34 who are not functioning well socially or maybe even romantically. Sexual stress or frustration is becoming a reason that many of them want to hurt other people. And their target usually is the women that they are upset with. People who often gravitate towards deviance or committing smaller crimes may escalate to committing larger crimes if there is not intervention put in place. Recent loss can often serve as a catalyst when it comes to the pathway toward violence. Most people who have gone on to commit acts of mass violence do go through some sort of loss, either personally, emotionally, or financially, in the months leading up to the event. This was present in the Florida school shooting in 2018. Although Nicholas Cruz had been planning for over a year to shoot and kill people, his mother's death did definitely escalate the plan of attack. More importantly, when Nicholas Cruz was told he couldn't continue at Marjory Stoneman Douglas High School, 3 days after he was informed of this, he purchased his first assault rifle. A lot of times you can connect the violent behavior with the losses and the stressors going on in their personal life. Individuals who use any type of substance in any amount are always at an increased risk of becoming violent. The reasons are because a lot of times using substances like alcohol, marijuana, methamphetamine, or even illicit drugs like ecstasy or mushrooms can limit the ways that you can perceive the world around you and limit your judgment. These substances tend to activate people and excite their central nervous system to the point where they cannot control themselves. Multiple life stressors at one time are often factors that we try to mitigate when it comes to the threat assessment process. If we're dealing with a student or a person who is going through financial hardship, who is dealing with the death of a loved one, who is dealing with their mental illness symptoms increasing, a lot of times those can combine to make them angry and hopeless. In our program, we often try to intervene with each factor on an individual level to help the individual get back on track. One of the most common things we look out for when it comes to the potential for violence is a history of violence. Many individuals who become violent might have a history of threatening or dangerous behavior, and this includes dangerous behavior towards animals and other human beings, including friends and family members. Access to weaponry is one of the biggest warning signs when it comes to evaluating someone for potential for violence. We want to know if this person has access to a gun or a knife, or maybe even smaller ways that they can use to hurt people, like hammers or even screwdrivers. If this person doesn't have access immediately, we also look in their personal life to see who they're affiliating themselves with. They might know an uncle, or they might know a best friend who has a parent who has a gun. All of these things can be risk factors when it comes to the potential for violence. Most individuals who are planning on executing a mass attack do have some level of interest in bomb or explosive making. This directly correlates to the Columbine school shooting. If you come across an individual or know of a student who is often researching past mass shooters or looking at mass shootings online, this can be a warning sign as well. A lot of individuals like to learn from past incidents because they want to do this better and they want a higher body count than the last person. One of the most important warning signs is an individual who might have an inordinate amount of information about past mass shooters. It is not common for a teenager or young child to know explicit details about past mass shooters or past mass shootings. This is often a behavior that people engage in when they are seeking to learn more about past mass attackers so they can commit their own mass attack. It's important to understand that one of the most common mass shootings that is continuously brought up among clients that we work with and those on a pathway towards violence is the Columbine High School shooting that happened in April of 1999. Columbine is important for many reasons. It was one of the first shootings that included multiple perpetrators, and it was one of the first shootings that was very sensationalized and covered by the media. Because of that, there's a vast amount of information online about this mass shooting, and there is a subculture that's been created to glorify these past mass shooters, unfortunately. This has inspired multiple past perpetrators to engage in shootings related to Columbine, but also that mimic the Columbine mass shooting. This first image is of a young woman who was 18 years old at the time of her planned attack, and she was so inspired by the Columbine High School shooting that she flew from her home state to Denver, Colorado, and the Colorado School District had to lock down because she was planning to return to the site to commit a mass shooting there. This next image is of a young man who was so inspired by the Columbine shootings that he took regular field trips to Colorado despite living in North Carolina. On the day that he perpetrated his attack, he had this written on the back as a way to pay homage to the perpetrators, and he mimicked those two perpetrators in the planning behaviors and stages of his attack as well. Because of the amount of information available on the internet, we're starting to see an uptick in violent events internationally. The individual in this image committed his attack in 2018 in Crimea on a completely different continent, over 20 years after the Columbine shooting occurred. Nevertheless, in the way that he planned and orchestrated his attack, there was evidence to show that he researched and mimicked Eric Harris, one of the Columbine shooters, when he committed his attack, both in the way that he dressed, the way that he eliminated his victims, and also the way that he brought smaller explosive devices on campus. The main four components that the school threat assessment response team investigates and tries to uncover in their threat assessment are communications, behaviors, dynamics, and access to weaponry. Communications are what is the student or concerning individual saying, or what are they communicating via their online postings or their text messages to other individuals. The behavior piece is the most concerning piece in threat assessment. If someone is behaving in ways where they start to look or act more dangerous, this is something that needs immediate intervention. Depending on the situation, we may involve mental health professionals, law enforcement professionals, or both in attempting to subdue or limit the behaviors that are dangerous. The dynamics are the why. With every person, there is a different story. People commit acts of violence for different reasons, and the reason is individualized to them. When we find out the dynamics or the why, that is usually what we target our intervention toward. Access to weaponry is the final factor that we consider when it comes to a threat assessment. It doesn't just have to be a gun, but individuals have used knives in the past, or other blunt objects that can be used to hurt people in the classroom or in public. When it comes to access to weaponry, we often work with mental health professionals, law enforcement professionals, the school, the family, and the individual to make sure that the person of concern is living in a safe environment for himself, herself, or others. So what should you do if you find yourself coming into contact with a person of concern? Often, the intervention or the immediate action depends on the case and what's happening right now. If someone is an immediate danger or threat to themselves or others and is actively trying to harm themselves or others, you need to call 911. If somebody is having a mental health episode and needs emergency psychiatric evaluation, you can call Access. And the phone number is 1-800-854-7771. This phone number is 24/7 and applies to any individual in Los Angeles County who might be struggling with a mental health episode. Another option is to call your local police department if you have concerns. They may not intervene immediately, but they can often guide you in the right direction on how to approach the individual and make sure everybody is safe. Most of the time when it comes to a concerning student or individual, we inform the school about what's going on so that they can seek to support the individual and get them help before they get in trouble on campus. If you find yourself coming into contact with a person of concern and they're not an immediate danger to themselves or others, and you feel like they may be on a pathway towards violence and need intervention, you can call the School Threat Assessment Response Team hotline. The phone number is 213-739-5565. This is also available for any individual in LA County who may be on a pathway towards violence specifically. To clarify, this doesn't include individuals who have regular angry outbursts, but this includes individuals who may be planning or preparing for a targeted mass attack. Some advice to the public: please don't ignore problems until they become bigger problems. Get help as soon as you can. The earlier the intervention, the more that we can help the individual and the safer the public is. For parents or teachers or anybody that comes into contact with children, please be involved in your child's life. Get to know the friends that they hang out with. Understand the activities that they engage themselves in, both on campus and after school. Familiarize yourself with their bedroom. Understand what they're doing in their private space, not to invade their privacy, but to understand that your child may be safe and doesn't have access to anything that they can hurt themselves or other with. It's also important to do regular computer checks or cell phone checks when it comes to children and teenagers, because it gives you a good look into what they're looking at every day and what they're experiencing online. Please engage young children and teenagers in conversations about difficult topics. Most young children and teenagers are going through times in their life where their emotions are running high and they may not understand how to navigate their environment or navigate difficult situations. If we open up a topic of discussion for them, they might be more willing to come forward with difficult situations or difficult topics. More often than not, young children, teenagers, and their peers know more information than the adults do. Please educate children on the warning signs as well and encourage them that if they see something, to say something. Thank you very much for your time and your attention. For more information, there will be a list of resources available associated with this video that are available for download.